today we'll be talking about a very necessary and essential biological and psychological issue. Many times it's discussed within the field of mental health, but we don't think about it as such. With the field of physical health, that's adverse childhood experience scoring. It's just a constellation of a number of occurrences that occurred before the age of 18 years that is a potent determinant of adverse sequelae later in life, complications and development of chronic medical diseases and also psychological diseases. So what are adverse childhood experience scorings? There are 10 of them. The first is having experienced physical abuse in childhood, having experienced psychological abuse in childhood, having experienced sexual abuse in childhood. Now, physical abuse, many times we know that what that one is, beatings with bruises. Psychological abuse are the kind of insults that many people had in childhood that eroded their core sense of worth and identity. Sexual abuse would go from the spectrum of unwanted touch by anyone who was 5 years older than you to frankly having had an unwanted sexual intercourse with an older adult before the age of 18, so count that as sexual assault. Then the other components will then include physical neglect and emotional neglect. Physical neglect would include lack of basic amenities. So those who grew up in abject poverty will be considered to have experienced physical neglect. Emotional neglect will be would include not feeling wanted. That would be a child who was born out of wedlock and was passed down from one relation to the other because nobody was willing to take over the responsibility and the care of that child. So that takes care of the first 5. The remaining 5 will then include having a household member who was incarcerated, was sent to jail. A household member. That would also include parental divorce. That would also include witnessing domestic violence. So daddy beating mommy, mommy beating father, mommy beating daddy. That would also include a mental illness, someone having a mental illness within the family, any type. That's considered one of such. Then parental death. So I said incarceration, substance abuse. Yes, that's the 10th one. The 10th one is having a family member struggling with substance abuse. All of this constellation, what creates is an unstable environment in the formative years, and you need that stable environment to be fully integrated as a human being, psychologically, biologically, and every other areas of life. What then happens later, a number of research, every research who does adverse childhood experience and will do a longitudinal follow-up would oftentimes report that those who have had an adverse childhood experience scoring of 2 and above are at higher risk of having chronic medical conditions, hypertension, diabetes, metabolic syndrome, obesity, chronic pain, psychosomatic disorders, and a number of other things. Then more than that, they're also at risk of developing mental health issues, depression, anxiety, psychosis, substance use disorders, addictions, and the likes. Why is this important? It's important because as an individual, if you find that you've had a number of this scoring, a number of this experience, the more you've had, the higher the chance that you are likely struggling with at least one form of psychological issue or the other. For those who would not struggle, despite having had 2, 3, or more adverse childhood experience scoring, likely there was someone outside the home who was a buffer for them. So while the house was on fire and in a state of wreck, there was a teacher who stood in for such a child, who provided the firm foundation, the place of safety and support where they could grow into a fully integrated individual. Maybe there was a grandma, maybe there was a church, maybe there was a clergy who took you up, who took you in. But for most other people, they will struggle with, at the least, a psychological sequelae, depression, anxiety, addiction, which is why I would usually say, and which is why science actually says too anyway, that addiction is a self-attempt to cope with deep psychological pain and psychological sequelae. So addiction is just not just bad habits. It is that there is a lot of baggage that has not been unraveled in their psychological landscape. So they are just, you're just seeing manifestations in such an individual. So someone who finds that they have a number of adverse childhood experience scoring and they're already having psychological sequelae, what would you do? You go ahead to seek treatment. Treatment would include therapy. Treatment would include bibliotherapy, that's you reading to really understand what happened to you. Treatment would include journaling. Treatment would include meditation, just such that you can unearth, unravel, and make sense and make new meanings out of what has happened to you. So that's the first recommendation. But for someone who now finds that, okay, I already have associated physical sequelae, maybe now you have chronic pains, you were given a diagnosis of psychosomatic disorder, and a number of other things, could even be hypertension in the young or diabetes and a number of other things. Please get me clear, I'm not saying all cases of hypertension and diabetes are caused by adverse childhood experiences. It is just a dose response curve. The higher and the more adverse childhood experiences you have had, the higher the chance you will come down with a physical chronic medical condition of the non-communicable type, or a psychological sequelae, or both in many cases. So trauma therapy is your real deal. Trauma therapy is your gold standard. Beyond whatever medication you're taking, you want to really unearth what has happened. If your biology has not caught up to the psychological landscape that you had growing up, it's only a matter of time. So if you're hearing me and you're able to tick the boxes and you got like 2, 3, please do reach out to a therapist. Except, like I said, if you can point to the fact that somebody stood in for you growing up, a teacher, a granny, an uncle, a clergy, the church, that you know this was your safe space. So you grew up in safety despite the hurricane that may have been happening at home. That's the first part of this conversation. The second part of this conversation now is prevention. If you're a parent or you are intending to be a parent, I would say first, get your life in shape. Take care of the trauma that was handed to you in childhood before you venture into these highly significant office of parenthood. Because sometimes whatever our parents handed over to us, positively or negatively, what was also handed over to them, it's only a few people that will do the hard work of unearthing what has happened to them and being able to grow out of it, make new meaning, and then make new decisions. Many people don't unlearn. So the first recommendation I would say is unlearn the templates, the blueprints that were given to you, unlearn the trauma responses, unlearn the psychological biomarkers and whatever it is you have, and learn new ways of dealing with life till you come to that place of being a robust, psychologically safe, and biologically sound individual who will then be able to procreate and bring children into the world. Because once you get to that place of safety, even your choices around spouses is with more clarity. You are not merenguing on people, because broken people will pick broken spouses. The truth is, the people you would attract to your life are those who are on the same psychological landscape with you, like it or not. So you want to get to a place where you're solid, and you would naturally be able to discern and attract those who are on at least a decent psychological landscape as you are. That way you have two whole people, whole, WHOLE, raising kids, not two broken people who then pass on their own brokenness down to the next generation. But now, supposing you already have kids, there's no going back. What is the way around it? You've had kids and you realize that you have a lot of unresolved trauma. While you're doing the hard work of working on your own trauma, you also want to be intentional that what happened to you ends with, and you don't pass it to the next generation. So it means your parenting is with an acute level of awareness and consciousness. Without a shadow of doubt, nobody is confused as to the fact that parental divorce is not the best for children, or that domestic violence, your children should not witness that, or incarceration, nobody should go to prison in the house, substance abuse, you want to get that sorted out. The area of argument as Africans many times is around discipline. So discipline many times, if it's not intentionally stewarded and is not being carried out by somebody who is psychologically old, who is not carrying the baggage of their own childhood, who is treating their own children the way their own parents treated them, many times discipline that is done by any other person who is still limping psychologically would be attributed or would tilt more towards trauma. So that would be an example of somebody beating a 2-year-old with belt, with ruler. That's abuse. That is not a discipline. As somebody of the Christian faith, the Bible says, "Stay abroad and spoil the child." And he also says that foolishness abound in the heart of a child, but the rod of correction will send it out. This rod of correction is the shepherd's rod, is the shepherd's staff. If you picture any shepherd, you don't see them beating and bruising their flock. Many times the rod is a rod of correction. It's not a rod of punishment. It's not a rod of cruelty. It's not a rod of brutality. Where am I going to with this? Our parents, those who did discipline, I think all of the millennial parents did discipline. But what a number of them got right is that connection was established. So while you were being beaten, you did not doubt that you loved. So that is my advice for the younger parents and for the Gen Z. I would not say leave your children undisciplined. In fact, that may be worse than if they are disciplined, because that would be that you have that's like difference between a trained dog and an untrained dog. One is more functional. One may be restricted if you have trained too much. But back to the human being, your connection with your child that you want to discipline must be intentional, must be robust, must be well stewarded. That's one. Two is that discipline should serve as a means of correction, of stewardship, of directing, of pointing your child towards the right and the appropriate direction, decisions, actions, and so on and so forth. What does that then mean? My child makes a mistake. Even if I want to spank you, I will let you know what you did and what you're being spanked. And when I'm done spanking you, I will tell you what you should have done and how it should have been done. If I'm holding rap space, I will show you and help you. That's one. Two is that my life must also model what it is I expect the children to do. I cannot be the screamer and be expecting children to be quiet. It's unlikely. I cannot be someone who lies. Somebody comes to look for you and you tell the children to say you are not around, and then you'll be the children for lying. No, it's not possible. That's a double standard. So you want to mirror a life that the children will naturally emulate without you saying much. It's said that our children will learn more by observation than by instruction. So your life has to be something that the children naturally want to emulate. So those two must be well married for you to say that you are doing discipline. You're not doing punishment. And discipline should also be commensurate to the offense. If you sit with it, there are some disciplines that are straight from the pit of hell. Cutting children with blade in the name of the child stole. How does that change the stealing? Beating with electric pipes or with plumbing pipes until there are bruises and there are cuts on the skin. How does that change the child from lying? How does that change the child's unseriousness in school? When you look at it rationally, you will know this is just a repressed anger that the parent is just passing on to the child. So if we would be the parent who will not pass on trauma transgenerationally, we have to be intentional about how we parent. We have to be willing to unearth our own psychological landscape and deal with any traumatic experiences we have had which has not been resolved. It is only then we will be able to say we are raising whole children who would also not later in life feel their own adverse childhood experience scoring and be given a score of 4, a score of 5, and of course you know all the sequelae that would follow from biological health to psychological health. So this is what I want to discuss with us. I hope this would be enough to motivate a parent to make decisions that are pro-destiny as they raise their children. And I also hope that it will be enough motivation for somebody who has had a number of adverse childhood experiences to begin to seek healing, because I tell you, healing is possible. Biologically, healing is possible. Psychologically, healing is possible. But it will be still worded. Somebody has to put you through it in most cases, except you're somebody who can do the hard work of reading, researching, meditating, journaling your way out of it, which is very possible, praying your way out of it. But if you have to seek trauma therapy, it is necessary. It is necessary. So until next time, wishing you the best. God bless you.